So we are seeing here extraction forceps. First we will see the maxillary forceps. So first you have to see the parts of forceps. This is the handle. There are three parts: the handle, the beaks and the joint. So what is the basic difference between maxillary forceps and mandibular forceps is the beaks and handles are 180 degree to each other. That is straight forceps. The straight forceps are maxillary forceps, and in mandibular forceps the beaks are 90 degree. The beaks are 90 degree to the handle, as you can see in this forceps. So this is the mandibular forceps. This is the maxillary forceps. So first we will see maxillary anterior forceps. So in maxillary anterior forceps, both the beaks are identical. They are broad. When you see from above, both the beaks are identical and broad, and they close. Okay, so how do you use the forceps? You have to hold it like this, a palm up, and then you have to engage the root of maxillary anterior tooth like this, and you have to give a labial movement and mesial rotation for maxillary central incisor. Labial movement and mesial rotation, and for maxillary lateral incisor, labial and palatal movement, and the removal in labial direction. So labio-palatal movement and removal in labial direction. And for maxillary canines, again you have to hold it above the CEJ. For all the tooth, you have to hold it above the CEJ. You have to hold it like this, and then give a labial movement, a palatal movement, and removal in labial direction. You have to hold the alveolus. Give labial movement, palatal movement, and then removal in labial direction. Always in the labial direction. So this is maxillary anterior forceps. Now coming on to the maxillary premolar forceps. So what is the basic difference between anterior and premolar forceps is see the handle. You have to see the handle. The handle is curved for maxillary premolar forceps, and how you have to hold it? You have to hold it like this. So your palms, your fingers will go in the curvature of the handle like this, and both the beaks are identical, and they don't close. They are broad and they don't close. When you see the tip of the forceps, when you see the tip of the beaks, they are concave shape, so that they can adapt the surface area of premolar tooth. Okay, and they don't close. After closing the handle, they don't close. So what are the forces applied? You have to hold it like this on the curvature of the handle. You have to hold the premolar tooth like this, and you have to give a buccal movement and palatal movement, and removal in buccal direction. And same for second premolar, buccal movement and palatal movement, and removal in buccal direction. So all the tooth you have to remove in the buccal direction only. Okay, so this is the buccal direction. Now coming on to the maxillary molar forceps. So it's a paired forceps. Again the handles are curved like this. The handles are curved. So how can you identify it's a right and left? So you have to hold it on your right hand. The right-handed operator will hold the forceps on the right hand, and your fingers will go on the curvature. So, and then you have to see the beaks. So the one beak is sharp, and one beak is broad. One beak is sharp and one beak is broad. So the sharp end will always go on the buccal side of the patient. So in this particular forceps, you can see the sharp beak is here, and the broad beak is here. So as the sharp beak will go on the buccal side, so where it will go, suppose this is a patient's head, So this is the sharp beak, it will go on the buccal side. So you have to engage it like this. Same for the left side, same for the right side of the patient. This beak is going on the buccal side. So how you will hold it? You have to hold it like this. So the sharp beak will always go on the buccal side. So it's easy to so that it's get easy to identify the side of the beaks. So as you can see, this is the sharp beak of the left forceps. This is the sharp beak of the right forceps. Okay. And what are the movements you will give? You will give a buccal movement, a lingual movement, and always remove on the buccal side, from the buccal side. So buccal movement, lingual movement, and removal from the buccal side. Okay, now coming on to the cow-horn forceps, maxillary cow-horn forceps. Same, the identification will be same. The pointed end will go on the buccal side. So here the pointed end is here. So this is the left-sided forceps. It will engage the buccal groove on the buccal roots. Okay. So this is the left-sided cow-horn forceps. This is a right-sided cow-horn forceps. Again, the cow-horn forceps are used for the extraction of a grossly decayed tooth. When the crown is not there, and the maxillary forceps is used when the crown is intact. Now coming on to the maxillary third molar forceps. It's a slightly long forceps. When you compare it with other forceps, it's longer than the normal anterior and posterior forceps. Why it's longer? Because to reach the third molar region, to reach the posteriorly. So it's a biangulated type of beak, you can see. Both the beaks are identical and concave shaped towards each other. When they face each other, they are concave and they don't close. And how to use it? You have to use it like this. Okay, you have to give buccal movement, lingual movement, and removal in the buccal direction. Okay, so this is a maxillary third molar forceps. Now coming on to the Bionite Forceps. The Bionite Forceps is used for removal of root stumps in whole of the maxillary arch, for the removal of root stumps. So it's also a biangulated beak. You can see angle here and an angle here. How to use it? You have to just hold the root and then give the desired movements required. Basically, you have to give a rotational movement. Okay. And by seeing the beaks, they touch each other and they are identical beaks, and they touch each other. So these are Bionite forceps. These are used for the removal of maxillary roots. Okay. So here we complete the maxillary forceps.